Right now, as you're watching this, there's a signal traveling from your brain down through your arms into your hands. Most people have no idea this signal exists. But when you learn to gently interrupt it, something remarkable happens. Your blood vessels relax, your heart doesn't have to work as hard, and your blood pressure can drop in less than 60 seconds. I'm going to show you exactly how this works. And more importantly, I'm going to teach you a simple hand technique that some of my patients use when they feel their pressure rising. But first, you need to understand why your body creates high blood pressure in the first place. Because it's not what you think. I've been practicing medicine for over 2 decades, specializing in cardiovascular health and helping patients over 50 manage their blood pressure naturally alongside their prescribed treatments. I want to be clear from the start. This video is for educational purposes only. Nothing I share here replaces medical advice from your doctor. Never stop or change your medication without consulting your physician first. What I'm about to teach you is a supportive technique. It's something you can do at home that may help support your body's natural regulation systems. Some people notice changes quickly, others take longer. Everyone is different. But the science behind this is solid, and I think you deserve to understand how your own body works. Here's what most people get wrong about blood pressure. They think it's a plumbing problem. Too much pressure in the pipes. And yes, that's part of it. But it's not the whole story. Your blood pressure is actually a control system. Think of it like a thermostat. When your body perceives stress, physical or emotional, your brain sends signals through your nervous system. These signals tell your blood vessels to tighten. Your heart rate goes up. Your pressure rises. It's automatic. It happens without you thinking about it. But here's the key. If it's automatic, that means there's a signal. And if there's a signal, you can influence it. You can't stop the signal completely, but you can teach your body to dial it down. That's what this hand technique does. Let me explain the mechanism in simple terms. Your autonomic nervous system has 2 branches. One is called the sympathetic nervous system. That's your fight or flight response. When it's active, your blood vessels constrict. Your heart pumps harder, your pressure goes up. The other branch is called the parasympathetic nervous system. Think of it as your rest and digest mode. When this system is active, your blood vessels relax, your heart rate slows, your pressure comes down. Now, here's where it gets interesting. Your hands have more nerve endings per square inch than almost anywhere else on your body. When you apply gentle pressure to specific points on your hands, you're sending signals back up to your brain. These signals can activate your parasympathetic nervous system. It's like flipping a switch. Not instantly, not dramatically, but enough that your body starts to shift from stress mode into calm mode. And when that happens, your blood vessels relax, blood flows more easily, and your pressure can drop. Let me tell you about a patient I worked with a few years ago. We'll call her Margaret. She was 67. She'd been on blood pressure medication for about 10 years. Her numbers were okay, but not great. She was sitting around 140/90 most days. But here's what frustrated her. She would check her pressure in the morning, and it would be 135/85. Not terrible. Then she'd check it again after lunch, and it would spike to 150/95. She couldn't figure out why. She was doing everything right, taking her medication, eating less salt, walking every day. But her numbers kept bouncing around. She felt like her body wasn't cooperating. She told me something I hear far too often. She said, I started dreading checking my blood pressure. Every time I reached for the monitor, my chest would tighten. When I explained the nervous system connection to her, something clicked. She realized that after lunch she was usually paying bills or reading emails. Things that made her feel tense. Her body was responding to that tension. The medication was working, but her stress response was working against it. I taught her the hand technique, not as a replacement for her medication, but as a tool she could use when she felt that tension building. Within 2 weeks, she told me her afternoon readings were more stable. She felt more in control. And that sense of control actually helped her relax even more. Now I want to address something important. Blood pressure medication works. It saves lives. If your doctor has prescribed it, you need to take it. But medication doesn't always address the nervous system component. Your body is designed to adapt. When you're under chronic stress, even low-level stress, your sympathetic nervous system stays partially activated. It's like having one foot on the gas pedal all the time. The medication helps, but your body is still sending signals to tighten those blood vessels. This is why some people take their medication perfectly and still see their numbers fluctuate throughout the day. It's not that the medication isn't working, it's that there's another layer underneath. A layer that responds to signals, not chemistry. That's where techniques like this come in. They're not replacing anything. They're supporting your body's natural ability to regulate itself. And when you combine them with your prescribed treatment, you give yourself the best chance at stable, healthy numbers. The truth is, your blood pressure isn't just about what you eat or what medication you take. It's also about what your nervous system is doing moment to moment throughout the day. And most people have never been taught how to influence that. Think about it. When was the last time your doctor showed you how to calm your nervous system? They probably told you to reduce stress, but did they teach you how? Probably not. Because most medical training focuses on medication and lifestyle changes like diet and exercise. The nervous system piece gets overlooked. But it shouldn't, because your nervous system is running the show. It's controlling your blood vessels. It's adjusting your heart rate. It's responding to every email, every bill, every tense conversation. And unless you give it a way to release that tension, it just keeps building. That's what makes this hand technique so valuable. It gives you a tool, something simple, something you can do anywhere, something that works with your body's own design. Before I show you the main technique, I want you to try something simple right now, just as a way to feel the connection between your nervous system and your hands. Place your right hand over your heart. Just rest it there, gently. Now take a slow breath in through your nose for 4 seconds. Hold it for 2 seconds. Then breathe out through your mouth for 6 seconds. Do that 3 times. As you breathe, notice how your hand feels. You might feel warmth. You might feel your heart beat. That's the connection. That's your nervous system responding to gentle attention. This simple breathing technique is something you can do anytime. It's safe, it's calming, and it starts to train your body to recognize what relaxation feels like. If you have any concerns about deep breathing, especially if you have lung conditions, just breathe normally. Comfort is always the priority. Now let me show you the 60-second hand technique. This is what some of my patients use when they feel their pressure rising or when they want to support their body's natural regulation before checking their numbers. Step 1. Sit comfortably. Feet flat on the floor, back supported. You want to feel stable and relaxed. This isn't about strain. It's about signaling to your body that you're safe. Step 2. Take your left thumb and find the fleshy part between the thumb and index finger of your right hand. That's called the webbing. Press gently into that area. You're looking for a spot that feels slightly tender but not painful. When you find it, apply steady, gentle pressure for about 15 seconds. While you're pressing, breathe slowly. In through your nose, out through your mouth. Let your shoulders drop. The pressure should feel firm but comfortable. You're not trying to hurt yourself. You're just sending a signal. Step 3. Switch hands. Use your right thumb to find the same spot on your left hand. Press gently for another 15 seconds. Keep breathing slowly. You might notice your heart rate starting to slow. You might feel your shoulders relax. These are signs that your parasympathetic nervous system is waking up. Step 4. Now move to the inside of your wrist. About 2 finger widths below the base of your palm. There's a point there that corresponds to circulation and heart rhythm in traditional pressure point systems. Press gently with your thumb for 15 seconds on your right wrist. Then switch and do the left wrist. Step 5. Finish by placing both hands over your belly. Breathe deeply into your hands for about 20 seconds. Feel your belly rise and fall. This final step completes the cycle. It tells your body that the stress response can fully turn off now. The entire sequence takes about 60 seconds. You can do it sitting at your kitchen table, in your car before you drive, before you check your blood pressure, anytime you feel tension building. Now, a few safety notes. If you're on blood thinners, be gentle. Don't press hard enough to cause bruising. If you have neuropathy or reduced sensation in your hands, adjust the pressure so you can feel it, but it doesn't cause discomfort. And if you have any hand injuries or arthritis pain, skip any points that hurt. This should never cause pain. Some of my patients do this technique first thing in the morning. Others do it right before they check their blood pressure. Some do it in the middle of the day when they feel stress building. There's no wrong time. The key is consistency. You might be wondering why this works. Why pressing on your hands has anything to do with blood pressure. Let me explain a bit more. Your hands are incredibly sensitive. They're designed that way. You use them to interact with the world, to feel texture, temperature, pressure. All of that information gets sent back to your brain through millions of nerve pathways. When you apply pressure to specific points on your hands, you're activating nerve receptors. These receptors send signals up through your spinal cord to your brainstem. Your brainstem is where your autonomic nervous system is controlled. It's the command center. When those pressure signals arrive at your brainstem, they create a shift. Your brain interprets the gentle, rhythmic pressure as a sign of safety, a sign that you're not in danger. And when your brain believes you're safe, it tells your sympathetic nervous system to stand down. It activates your parasympathetic nervous system instead. This isn't magic, it's neurology. It's how your body is designed to work. The problem is, most people go through their entire lives never learning how to intentionally activate this system. They rely on it to turn on automatically, maybe when they sleep or when they're on vacation. But they never learn to trigger it on purpose. That's what this technique teaches you. How to flip that switch deliberately. How to tell your body, in a language it understands, that it's okay to relax. Here's what happens when you practice this technique regularly. Not once, not twice, but daily for several weeks. Your nervous system starts to recalibrate. It learns that it doesn't need to stay in high alert mode all the time. The sympathetic response, that fight or flight signal, starts to quiet down. Your baseline stress level drops. When your baseline stress drops, your blood vessels spend more time in a relaxed state. They become more flexible. Blood flows more easily. Your heart doesn't have to work as hard to push blood through your system. Over time, this can support healthier average blood pressure readings. Not overnight, not dramatically, but gradually. The way the body prefers to change. You're also improving something called heart rate variability. That's your heart's ability to adapt to different situations. Higher variability is a sign of a healthy, responsive nervous system. Lower variability is a sign of chronic stress. This technique helps move you toward higher variability, and there's another benefit that many people don't expect. When you practice this regularly, you become more aware of your body's stress signals. You notice tension earlier. You can intervene before your pressure spikes. That sense of control reduces anxiety, which itself helps keep your pressure more stable. I've had patients tell me they sleep better after starting this practice. Others say they feel less irritable. Some notice their digestion improves. These might seem unrelated to blood pressure, but they're all connected. They're all signs of a nervous system that's finding better balance. Let me be very clear about what you can expect. Some people try this technique and feel an immediate sense of calm. They check their blood pressure afterward and see it drop by 5 or 10 points. That's wonderful. But that's not everyone. Other people practice for a week or two and don't notice much change at all. Then, in week 3 or 4, they realize their afternoon readings are more consistent, or they sleep better, or they feel less anxious when they think about checking their pressure. The timeline is different for everyone. Your body has its own rhythm. Your stress patterns are unique. The important thing is consistency. If you try this once and expect a miracle, you'll be disappointed. But if you make it a daily habit, you're giving your nervous system a chance to relearn a healthier pattern. I also want to emphasize that this is not a replacement for medication. If your doctor has prescribed blood pressure medication, keep taking it. This technique works alongside medical treatment. It supports what your medication is already doing. And please, track your numbers. Write them down. show them to your doctor. If you notice consistent improvements, your doctor may adjust your medication. But that decision has to come from them, not from you stopping on your own. Some people ask me if they can do this technique more than once a day. Absolutely. There's no limit. If you feel tension building multiple times throughout the day, use it multiple times. The more you practice, the more your nervous system learns. Others ask if they can do it for longer than 60 seconds. Yes, if you want to. Spend 2 minutes or 5 minutes on it, that's fine. Just don't make it so long that it becomes a chore. The goal is simplicity, something you'll actually do. And here's something interesting. The more you practice this, the less time you might need. Some of my long-term patients tell me they can activate their relaxation response now just by taking a deep breath and placing their hand on their chest. They've trained their nervous system so well that it responds almost instantly. That's the real goal here, not to depend on a technique forever, but to retrain your nervous system so that relaxation becomes your default state instead of tension. Think about how powerful that would be. Instead of walking around all day with your shoulders tight and your jaw clenched, you're relaxed. Your blood vessels are open. Your heart is beating calmly. Your pressure stays stable. That's not just better for your cardiovascular health. That's better for your whole life. You think more clearly. You will sleep better. You enjoy things more. You're more patient with the people around you. This is why I'm so passionate about teaching these techniques. Because blood pressure isn't just a number. It's a reflection of how your body is coping with the world. And when you give your body better tools to cope, everything improves. If this information made sense to you, I'd really appreciate it if you'd subscribe to this channel. I make videos like this every week, breaking down health topics in ways that actually make sense for people over 50. No hype, no false promises, just clear, practical information you can use. And here's what I'd love you to do right now. In the comments below, just type the words, "I'm trying this today." That's it. It's a simple commitment. And when you put it out there, you're more likely to actually do it. Plus, it helps me know what's resonating with you so I can make more videos like this. Even if you don't comment, pause this video for a moment and decide when today you'll try it. Small decisions repeated daily create real change. If you found this helpful, please share it with someone who's struggling with their blood pressure. A spouse, a parent, a friend. This kind of information is more powerful when it's shared. In my next video, I'm going to talk about something that surprises a lot of people. It's about the connection between your jaw tension and your blood pressure. Most people clench their jaw without even realizing it, and it sends stress signals directly to their cardiovascular system. I'm going to show you a 2-minute release technique that some of my patients say works even better than this hand method. So make sure you're subscribed and have notifications turned on. That video is coming soon. Until then, try this technique. Be patient with yourself, and remember, you have more control over your health than you think. You just need to understand how the signals work. Thank you for watching. Take care of yourself.